Good afternoon, everyone. I'm Dimuthu Disanayaka. Now I am going to discuss a past paper of renal nursing. Since we have no time to discuss whole paper, I am going to discuss only 20 questions. So this is uh, September semester 2017 September semester paper. So it's in your Moodle also. So now we'll discuss one by one. First question is which hormone is secreted by the kidneys? So answers are renin, B. pepsin, C. aldosterone, D. somatostatin. So I think you know the answer already. Renin is a hormone which is secreted by the kidneys and which regulates blood pressure. So answer for the first question is A, that is renin. So if we take the other answers, pepsin is a digestive enzyme which is secreted by the cheap cells of stomach. So what pepsin do is it convert protein into amino acid. If we take aldosterone, it is a hormone secreted by adrenal cortex and it regulates sodium concentration in the blood. Somatostatin is a hormone which is released by pancreas. The cells of the islets of Langerhans secretes somatostatin. It is also called as growth hormone inhibiting hormone. So this somatostatin regulates endocrine system and it regulates neurotransmission also. So answer for the first question is answer A, renin. So what's the second question? Second question is what is the approximate percentage of cardiac output should the kidney received? To properly function the kidney should receive 25 to 30% of cardiac output. So answer is D, 25 to 30%. We'll see what's the third question. Third question is which of the following is etiology of intrarenal azotemia? So first of all we will see what is azotemia. Azotemia is abnormally high levels of nitrogen containing compounds like urea and creatinine. So if these contain nitrogenous compounds are high in blood, we called as azotemia. So a reason for azotemia is actually the kidney failure. So when there is heart failure, kidney failure can occur, but it's not the intrarenal etiology. Intrarenal etiology means reason within the kidney. So heart failure is a extrarenal cause for azotemia. So nephrotoxin drugs, second answer is the nephrotoxin drugs. Nephrotoxin drugs are the drugs which is toxic to the nephrons. So due to this toxicity, nephrons will get damaged, so that can lead to renal failure. So nephrotoxin drugs will be a reason for intrarenal azotemia. And then neurogenic bladder. Neurogenic bladder means the lack of bladder control due to nerve damage. So due to this reason, incontinence and urine retention like problems can happen. When there is a urine retention, it can be indirectly cause for azotemia. So but it is out of the kidney. The reason is out of the kidney, so it's not a intrarenal cause. Then anaphylactic reactions occurs within the blood, so this can lead to hypotension, decreased blood pressure, then it indirectly affect for kidney failure. So anaphylactic reaction is also maybe a cause, indirect cause for azotemia, but it's also not the intrarenal the cause within the kidney. So the answer for the third question is nephrotoxin drugs, because it asks about the reason, intrarenal reason for azotemia. Then we look at the fourth question. Fourth question is, which of the following is true about acute post-streptococcal glomerulonephritis? So by the term, you know what is mean by post-streptococcal glomerulonephritis. Post means after. After the streptococcal infection, if glomerular inflammation of the glomerulus and nephrons occurs, it is called as post-streptococcal glomerulonephritis. So because of this reason, so nephrons will be inflamed. So through these nephrons, albumins can leak out. So albumin can go to the urine. So it causes albuminuria. So it doesn't cause hypoalbuminemia. So so the second answer, it occurs primarily in the elderly. No, it primarily occurs in children, and it trails a streptococcal infection. Yes, it's a sign of streptococcal infection. So it can be answer. And then answer D is, it is treated with immunosuppressives. No, although there is a immune reaction, main focus of treatment is to reduce the high blood pressure and the inflammation. So treatment is focused on reduce hypertension and edema, so not the suppression. So answer for the fourth question is C. It trails a streptococcal infection. Question number 5. Which patient care is needed immediately after a renal angiogram? You know that renal angiogram is doing using contrast media, so that can be a allergy, that can cause allergies to patient. So So what's the answer for the fifth question? Answer A is assessing the pedal pulses. Answer B, removing the pressure dressing after 6 hours. Um, Answer C, assisting patient to the bathroom immediately. Answer D is providing education on the purposes of the test. So answer D we can reject because providing education should be done before to the test, so not after the test. So what's the best answer among answer A, B and C? So client care after renal angiogram includes bed rest for 9 to 24 hours, frequent assessment of vital signs and pedal pulses for peripheral circulation, assessment of bleeding or hematoma formation at catheter insertion site, maintenance of pressure dressing for 24 hours, and observe for allergic reaction. So the best answer is answer A, assessing the pedal pulses. Why it is important is when there is a damage to the arteries, blood clots due to this damage of the arterial wall, blood clots can form. So these blood clots can obstruct the artery and then thereby obstruct the blood flow to the periphery. So it is very important to assess the pedal pulses. So answer is A for the fifth question, assessing the pedal pulses. Removing the pressure dressing after 6 hours. Actually you have to keep the pressure dressing for 24 hours to prevent leakage or prevent any bleeding. So you can't assist the patient to the bathroom immediately because the patient need to bed rest for 9 to 24 hours. Then sixth question. Which of the following best describe creatinine clearance? Okay, so creatinine clearance is the rate at which a waste creatinine is cleared from the blood by the kidneys. So it shows the status of renal function. So answer A is stage of chronic renal disease. Answer B, the rate of blood flow through the kidneys. Answer C, measurement of diminishing renal function. And answer D, measurement of how rapidly the kidney clear drug from the plasma. So answer is C. Actually it shows the status of renal function. So it's a measurement of diminishing renal function. If the creatinine clearance is low, it shows actually if the creatinine clearance is low, it shows the diminishing renal function. Then question number 7. Which of the following is the major risk factor for kidney disease? So all the given answers are risk factors for kidney disease, but it asks about the major risk factor. Answer is hypertension. Answer B, diabetes mellitus. Answer C, autoimmune disease. And then answer for hypercholesterolemia. So all these things can lead to kidney disease, but a major risk factor is diabetes mellitus. So answer is B, diabetes mellitus. Then question number 8. Which of the following is the long-term management for kidney transplant recipients? So answer A, evaluate for infection. Answer B, measure antibody levels. Answer C, stop all immunosuppressants. Answer D, monitoring of delayed graft function. So actually you have to evaluate for infection until the wound will recover, and actually especially you have to keep the patient isolated until all the drains are removed, and you have to continue the immunosuppression, not stop it. So the long-term management of kidney transplant includes continuing immunosuppressant and monitoring the graft function. So delayed graft function means functioning of the transplanted kidney. If the functioning is get delayed, it is called delayed graft function. This is the thing you have to look for. Then so the answer for question number 8 is answer D, monitoring of delayed graft function. Then question number 9. Which statement related to the use of anti-anemic drugs in patients with kidney failure is true? So we give iron for kidney failure patients as anti-anemic drugs. So the question ask about which is true about anti-anemic drugs. Answer A is iron stores must be monitored periodically. Yes, it's true, because if there is excess iron, it can be cause serious problems. So iron storage should be monitored periodically. Answer B is adequacy of dialysis does not need to be evaluated. Actually, adequacy of dialysis is need to be evaluated of kidney failure patients, and its consumption has no impact on long-term problems, because when there is excess science, it can cause serious problems, as I told earlier. We cannot say its consumption has no impact. And then answer D, oral iron and phosphate binders can be administered concurrently. That means oral iron and phosphate binders can be administered at the same time. It's false, because iron acts as a phosphate binder, and so it attract phosphate and bind the phosphate ion, and it pass with the PC. So the iron concentration of the body will be less. So for these patients, iron absorption should be high. So when the ions when the ions form compounds with phosphate, so the body or the blood cannot absorb iron. So oral iron and phosphate binders we cannot administered concurrently, means at the same time. Mm, so the best answer is answer A. That is, iron stores must be monitored periodically. Then question number 10. So question number 10 and 11 is based on following scenario. The scenario is Mr. A, 32 years old, attended the clinic with complaint of mild to moderate dull aching, burning pain in the right side of the abdomen and back for the last 1 month. The pain aggravates on motion and ameliorates on rest. Ultrasound of abdomen shows a calculus of 12 millimeter size in right kidney. Question number 10 asks, a nursing diagnosis was identified for Mr. A as acute pain related to movement of the calculus as evidenced by verbal reports of pain. What is the best expected outcome for pain? Actually, the problem the client has is acute pain, so your planning should be to minimize this pain. So the expected outcome will be minimizing pain. So how to minimize, how to measure this pain? So if the patient reports that he has less pain, so it should be the expected outcome. So among the given answers, answer D is the correct one, because answer D is he reports pain control at a level less than 3 to 4 on a 0 to 10 rating scale. So what about the answer C? It says he reports pain control at a level of 6 to 7 on a 0 to 10 rating scale. So 6 to 7, level 6 to 7 of pain means it is moderate pain, and level less than 3 to 4 means mild pain. So our aim should be to minimize the pain as much as possible. So but the best answer is answer D. He reports pain control at a level less than 3 to 4 on a 0 to 10 rating scale. So what about answer B? Answer B is he demonstrates relief of pain on his facial expression. So why it is wrong? So actually we cannot exactly say about pain using facial expression, because you know that if you know about the cultures, different cultures of patients, some cultures they hide pain and they don't like to express pain. So we cannot accurately say the pain has reduced. So answer B is wrong. Question number 11. What is the best rationale for using non-pharmacological pain management method as one of the nursing interventions for Mr. A? Actually, we use non-pharmacological pain management if we the answer is C, because the answer is C. Answer C is to provide patient with a sense of control. That means sense of control means the patient has should be able to control his pain. So if we use drugs, so that means pharmacological management, the patient cannot control it. So to provide with a sense of control, that means if he can we need to show that the pain can be controlled by himself. So it's the um, aim of non-pharmacological pain management. Then we'll move on to the 12th question. The question is, which is the first sign of peritoneal catheter exit site infection? So answer is A. Tenderness is the early sign of infection. Then question number 13. Which of the following is correct cycle in peritoneal dialysis? Sorry. How do you do peritoneal dialysis? So what do you do in peritoneal dialysis? You first insert the dialysate to the peritoneal cavity, then keep it 3 to 4 hours, so few hours, and then you take that drainage or fluid back. The correct cycle is infusion, dwell-in and drainage. Dwell-in means you keep it for some time. So answer is A. Infusion, dwell and drainage. Question number 14. Which is the most important home care management should a peritoneal dialysis nurse provide to the patient and family? Answer A. Provide miliotherapy. Answer B. Focus on culturally sensitive care. Answer C. Provide support and continuous education. Answer D. Establish good rapport with patient and family. So it asks most important home care. All these are important, but a question asks about the most important home care management. So answer is answer C. Provide support and continuous education. We see the other answers. Provide miliotherapy. So what is miliotherapy? So miliotherapy is a form of psychotherapy which changes the patient environment for therapeutic purposes. So it basically doing in the hospitals, but in the community also you can do, and so culturally sensitive care is also, we have to think about that. But the most important thing is providing support for dialysis and education about dialysis. That's the most important. Although all these answers are true, it asks about the most important home care management. So answer is C. Provide support and continuous education. Then question number 15. Which is the most desired goal of antihypertensive therapy in patients with chronic kidney disease? So why we try to reduce the blood pressure in chronic kidney disease patient? Through this antihypertensive therapy, you cannot prevent anemia and other complications. So you can, although we can reduce some other complications, you cannot prevent anemia through antihypertensive therapy. So answer A is wrong. Answer B, decrease renal blood flow and level of creatinine. So by decreasing high blood pressure, you cannot um, decrease the level of creatinine. So actually we should not reduce the renal blood flow. So it can aggravate the kidney failure. So answer B is also wrong. Then answer C, avoid cardiovascular and respiratory complication by reducing the blood pressure, or although you can avoid cardiovascular complications, you cannot avoid respiratory complications. Then answer D, slow the rate of progression and reduce proteinuria. Yes, answer D is true. So by reducing high blood pressure, you can reduce the complications of the kidney diseases, and you can reduce proteinuria because the filtration of protein into urea will be reduced when there is no high blood pressure. So answer is D, slow the rate of progression and reduce protein urea. Question number 16. Which is the indicator of a patent arteriovenous fistula? So you know that when before hemodialysis takes place, we have to create arteriovenous fistula for a patient who is hope to undergo hemodialysis. So how do you check whether the arteriovenous fistula is working properly? So you have to palpate over the fistula for the thrill. So answer is B, palpable of thrill over the fistula. Question number 17. Which is the significant blood result of a patient with renal disorder? So when there is a renal disorder, urea level will goes up. So answer A is wrong. It says decrease urea level, not in when there is a renal disorder, urea level will be increased. Then elevated creatinine level, yes, answer is B. When there is a renal disorder, creatinine level goes up, and when there is a renal disorder, hemoglobin level will go down. Chronic renal disorder where hemoglobin level will go down, not increase in hemoglobin level. And there is to decrease red blood cell count, it takes a long time. So the best answer is answer B, elevated creatinine level. Then question number 18. The following findings were noted from Mr. X's record on 1 week after kidney transplantation. Temperature 38.8 Celsius, that means hyperthermia, blood pressure 190 by 100, KUB X-ray, kidney shows kidney is enlarged, physical examination shows kidney is tender. So question is, which of the following complications would you suspect based on the above assessment findings? All these signs are the signs of acute rejection of the kidney, which occurs 4 days to 2 weeks, 2 months after the transplantation. Then question number 19. You are taking the history of Mr. M, who has had benign prostatic hyperplasia 5 years ago. Which is the early symptom that determines Mr. M is currently experiencing difficulty in urinating. So answer urinary retention is actually urine answer is D, decreased force in the stream of urine. Question number 20. A nurse performed an assessment on Miss A and found she is about dry weight. Which food should the nurse advise Miss A to avoid? Actually, what do you mean by dry weight? Dry weight is the weight of the body without extra fluids. So the patient is above dry weight means she has extra fluid in her body. Then the patient should be avoided extra fluid or water. Which food that she should avoid? Egg, bread, watermelon, roasted chicken. So which contains high amount of water? Answer C, watermelon. Watermelon, compared to other food items, watermelon contains high amount of water, so she should avoid watermelon because she already has extra amount of fluid. So yes, so I will stop now, so because we have no more time to discuss the other questions. So if you have any questions, you can go through the whole paper, and we have given the answers are highlighted. So if you have any doubt with the answers, you can ask from me or any other academic in our department. Thank you.